Yeah, so welcome to the third LTC COVID webinar. We're waiting for a few more people. We're going to give it a couple of minutes. So in the meantime, I can announce next week's webinar. And next week is going to be about the care of people with dementia during COVID. And we're going to have Aida Suarez Gonzalez, who's been compiling already two reports, one on situation in Spain and one in the UK. There's a new version of the UK report coming out today, I hope. And she's also helping coordinate an international report. And of course, we're very happy to hear from more people who might want to join that effort, because gathering this information is a big piece of work. So Aida will give an overview of what she's found so far from this international evidence on how COVID is affected the care of people with dementia. Then we're going to have Gloria Wong from Hong Kong University, who will talk about delivering, I think it's delivering cognitive stimulation online. Do you want to quickly introduce it, Gloria?
Yeah, so actually, because internationally there are a lot of interest about where the intervention can be delivered online. In theory, that should be as effective as the in-person, but there are some caveats that we need to figure out. So next week, next week, I'll be talking a little bit more about what we have learned during the COVID-19 period.
That's great. We are also going to have a representative from Alzheimer's Disease International. I'm not sure whether it's going to be Wendy Weiner or Chris Lynch, so we will confirm the program as soon as they let me know. And we are also trying to find somebody who's been living with dementia who may have experienced changes in their care is able to speak, but we're not able to confirm that yet. But as soon as we know, we'll send around the conference program. So Malaysia. So I'm very, very happy to then introduce Maupin from the University of Malaya, who has been working on LTC COVID report on Malaysia. We published an updated version yesterday. Thank you so much for all the information you have shared, and we'd be delighted to hear more. Please, thank you very much.
Okay, I'll try and see whether I can get this done. Yep. Okay, it's always a bit dodgy trying to share my screen on Zoom. Okay, there we are. Okay, can you see? Whoops.
Yes, thank you.
Yeah, okay. So, right. So, basically, I'm a geriatrician, and I'm based at the University of Malaya, which is actually a institution of higher learning, as you probably gathered. But most of our healthcare is actually provided by the Ministry of Health in Malaysia, and in the Ministry of Higher Education, we also provide government-funded care, but it's subsidized, whereas Ministry of Healthcare is free. And then we have the private sector, which actually provides care for about 30% of the population, and it's funded by insurance, and so 30% of our population are insured. Oops, let me see. Okay, so this Malaysia has 32.3 million. Okay, so 32.3 million people, and 2 million of our population is over 62 years. So compared to a lot of the rest of the world, we're probably considered quite a young population, but our population is aging at a very rapid rate. And what is quite luxurious for us is that only 1% of our older people, and not 1% of our population, but 1% of our 2 million older people live in care homes. When it comes to 1%, it's 1% of over 60, because Malaysians seem to age a bit faster. So a lot of times by the time they're over 60, they need care. Most of our long-term care is actually home-based and mainly provided by informal sources. So mainly female members of the family. If it's a man, usually the the wife, but if the wife is incapacitated or elderly, then sometimes it's the daughter, usually it's the daughter or the daughter-in-law, and sometimes it's grandchildren, mainly granddaughters, who are actually in between kind of leaving school and higher education, or in between jobs. They are actually obligated to look after their grandparent. But obviously, there's an overrepresentation of people in care homes in our hospitals. So 7% of our hospital admissions are actually from care homes, even though care home residents only make up 1% of our overall older population. And when they come into hospital, they stay for a lot longer than the other ones, and they keep coming. There is really very little we can do to stop them admitting patients to hospital as soon as the older person is ill, because they all use our hospitals as a first port of call, seeing as we have a very limited community-based care that is actually suitable for older people. So we have most of our care homes in Malaysia, as opposed to healthcare, social care is almost exclusively privately funded. Our government only runs 17 of our care homes, mainly residential care, and only 2 of our care homes funded by the government are actually nursing care, and the number of beds available are reducing, not increasing, because the government's actually trying to actually depart from providing residential institutionalized care. We have our care homes which are mostly unregistered. So we don't really know exactly what number are unregistered, but within our registry, there are 2 registries at the moment, which will merge into one, hopefully by the end of this year. So at the moment, the registries are held by the Welfare Department, as well as the Ministry of Health. And most of them are actually registered as care centers under the the Welfare Department, and only about 100 of them are actually registered under the Ministry of Health. Over on the right-hand side of your screen, you'll see that I've listed where most of the registered and unregistered care homes are actually funded by. So quite a few residential care homes are actually still funded by NGOs and religious organizations. So you wouldn't tend to go to a residential home, or in Malaysia it's called an old folks home. I know it sounds really quite archaic, but they're still called that. Most of them will not go there unless they have no children, or they are poor and they're unable to look after them after themselves when they grow older. So most of these older folks in these residential settings are actually quite independent. They more or less look after each other. And most of these care homes are funded by religious organizations or non-governmental organizations. And we have an explosion in the number of nursing homes in Malaysia. And most of them are actually privately owned, and majority of them are not registered. And they kind of appear and disappear quite quickly. Most of them use landed properties that are 2-story detached properties with about 3 or 4, sometimes 5 bedrooms. So they're relatively small enterprises. So this is a nice care home in Malaysia, so most of them are most of the beds are spaced about 1 meter apart. This is a luxurious home, so some of the homes, the beds are actually spaced quite closely together, and all the residents' belongings would be in that locker. So they are quite kind of basic type of setups, because unfortunately, if you were very wealthy in Malaysia and could afford more, then you would actually hire full-time caregivers to come into your house to look after you. So, this actually mainly caters for the middle class, and so their affordability is low because there is no subsidies from the government. So just a little bit about what COVID-19 has been like in Malaysia. We actually are still under a movement controlled order. So we are here right now. So it's called a relaxed movement control order, or a controlled movement control order, where we actually now have 80% of our businesses back in action. But this was started because of a very large gathering of about 15,000 people. It's a religious gathering, and that exposed 15,000 people to COVID-19. Eventually, about 3,000 of that group caught COVID-19, and they scattered all over the country. So our government was actually forced to enforce a movement control order on the 18th of March. So we've pretty much been shut down now for 2.5 to nearly 3 months. But the movement control was extremely effective, and it actually reduced our R0 to 0.6. And even after we relaxed our movement control order, our R0 continued to reduce, and it's now 0.3. So as of the last week, we've had no new deaths from COVID-19, and there are only 1,400 active cases. Our mortality rate is round about 1.4% from all the cases. So with regards to outbreaks, when it comes to care homes, we have not really got very detailed information, because most of the outbreak actually currently concentrates on foreign workers. So our government has not released very detailed information about care homes. We do know of an older persons cluster, and that was the 20th cluster to be declared by our Ministry of Health, and it made an official appearance only on the 22nd of April, even though we were aware of the first detected case from a care home from the 21st of March. And at the end, when they closed the cluster, there were 36 cases involved. There were 5 deaths, all older persons, and 3 of those deaths were from care homes. So not all the deaths were from care homes. And it was believed that the person from the care home had actually caught it in hospital and was then discharged to a care home and passed it on to the rest of the residents. So I think 2 people, two separate patients were discharged to 2 separate care homes, and only in one of the care homes was there any transmission. In the other care home, none of the other staff actually tested positive, but unfortunately that resident who came back to hospital died. So in the second care home, 5 residents and 5 staff actually got COVID-19, but only 1 other resident died, even though the index case also unfortunately did not make it. With regards, we have not heard of any other outbreaks involving older people or care homes. But since the 1st of May, that's Labor Day in Malaysia, we actually started mass screening in all our care homes. And the commitment is actually to screen homes whether they're registered or not. And so far, we've actually screened nearly 300 of the homes in existence. There were 12,000 residents in all the homes screened so far, but only 11,000 residents and staff got screened. I don't know what happened to the 1,000 who escaped. And only 26 positive cases were found, and so the positivity rate is only 0.2%. And what was a little bit scary was that 22 of them, which is 85%, were asymptomatic. So these are some pictures actually supplied to me by HCOPE, which is an association that represents all the residential aged care facilities. So our care homes are generally very clean. So these are 2 care homes, and you can see all these healthcare workers in their hazmat suits actually going into the care homes and screening them within the care homes. So the key policies that are in place today are that all the care home residents and staff are screened twice daily in terms of symptom screening and temperature. That's non-contact temperature using infrared thermometers. As far as possible, the care homes do not take in new admissions, and no visitors are allowed apart from if there was a death, there was someone who's actually terminally ill, they would actually allow the relatives to actually visit for compassionate reasons. All hospitals admissions, all hospital discharges to care homes, so they don't take any new admissions, but if the resident had been admitted to hospital, then there's a requirement that the resident returns to the care home. They are now being tested. It's mandatory, and it's a nationwide policy. And as far as possible, these residents are then barrier-nurse for 14 days in their care homes or isolated. As you can, from that picture that I showed you earlier, you can see, you probably gather that very few of them actually own single rooms. So isolation is a major challenge in these care homes. There is, the policy is no communal dining. So they all should be eating at their beds, no group activities, and as far as possible, social distancing measures. But our care homes in Malaysia, most of them have taken an extra step in actually asking all their workers to move in. And we just got showed a video today by one of our, made by one of our news agencies, and it's actually all the residents are being thoroughly spoiled because they've not really had quite so much attention for a long time because all the workers are in with them, but the workers that are feeling the strain because they've actually been separated from their families now for about 2.5 months. So it's not really a sustainable situation. So staff shortages are one of the main issues because actually a lot of the workers from our care homes actually were nurses waiting for placements under the Ministry of Health because they overtrained nurses. So a lot of the graduates couldn't find a job and ended up working in these care homes. But when COVID-19 came about, the Ministry of Health actually recalled a lot of the nurses, and the care homes had really very little choice but to agree to let them go. But that means that a lot of them are now short-staffed. And a lot of them, because of the lack of admissions, because some of their residents have, of course, passed on, being the clientele that they have. And so with no new admissions, they are facing financial difficulties, and particularly the NGO-funded care homes, they're having issues because of a reduced number of donations. At the start of the MCO, none of them had any PPEs. So when we did a survey, they were all totally out of gloves, hand sanitizers, aprons, and face masks. They are more available now, so more of them are actually owning some, but they can't use it as often as they would like. They still have to ration. And there is no government funding or provision of PPEs. And even for when we ask donors if they would actually mind giving face masks to care homes, they don't see it as something that they would give. Most will prefer to give money or give food. And because of the confined spaces that our care homes have, there's difficulty with social distancing. And of course, many of them are unregistered. So when we call them forward for screening, we don't know if all of them will come forward. Communication with authorities, such as changes in policies, etc., is difficult because the authorities don't know that these care homes are in existence. So some initiatives that's actually been brought about, not necessarily by the government. So as soon as COVID-19 appeared in Malaysia, we know that the Care Home Association, called HCO, which is only 2 years old, they only had their first AGM last year, and so they're quite enthusiastic, and they've been in regular communication with the members, and some of the policies had already been formed. But as soon as the movement control order came about on the 18th of March, there's a group of us who realized that actually the next wave could very well come from our care homes, knowing the sorry state of some of our care homes and the lack of regulation. We actually approached HCO and offered to help them develop an interim guideline, and also to work as a pressure group to actually pressure government agencies to do a lot of things. So, the guidelines were literally written in 3 days and translated to three other languages, that's Malay, Chinese, and Tamil, and circulated through Facebook, WhatsApp, and the mass media. Basically, we tell people, if you are in any way affiliated to a care home, please pass this on to them. And we also circulated these guidelines document to the Ministry of Health, as well as the Welfare Department, and continue to communicate with them and send them updates about our concerns, and to pressure them into actually accepting our interim guidelines. And they did indeed accept our interim guidelines a month later. Our Director General of Health actually thanked us during one of his daily announcements, and the Ministry of Health then adopted these guidelines and adapted them and circulated them to all the registered care homes. On the 1st of May 2020 was when the mass screening started. 5th of May was when the guidelines actually got circulated, and the 12th of May, I think it was 12th or the 18th of May, was when the letter that mandates testing on discharge was distributed. The Ministry of Welfare also had a 25 million ringgit handout. That's only about $6 million US dollars to actually for welfare jobs in Malaysia, for welfare handouts in Malaysia. And so the registered care homes all got a modest cash handout in order to cover some of their cash shortages and to fund some of the purchase of PPEs. So in summary, we've only had 3 care home deaths in Malaysia today that we know of from COVID-19. There's ongoing mass screening, and we put down the success of the lack of COVID cases in our care homes to collaborative working amongst the care home organization, academics, local and state governments, the ministries, as well as medical societies. But unfortunately, staffing, financial and PPE shortages persist, and the current ongoing policies are not really sustainable. So we are worried that the system will buckle and eventually COVID-19 will get in unless we have kind of provision of PPEs and some more help when it comes to staff shortages and regular testing. So thank you very much.
Thank you very much, Malpin. If there's any very quick clarification for Malpin, we will have a half-hour discussion at the end of the hour. But any very, very, very quick question? If not, we're going to move. 1 minute. No. Okay. So thank you very much. We're going to now move to another country. We're going to move to Hong Kong. Terry, you're ready to go. You're muted at the moment. So you like to unmute and share. Thank you.
Okay, right.
Thank you.
Let me see. Let me go to the share screen. Okay. So how many minutes I have? 20, 10. Oh, I can't hear you, Adelina.
You've got about 10 to 15 minutes.
Okay, I try my best. So first one is thank you for giving me this opportunity to share, our experience in controlling the spread of COVID-19 in Hong Kong. So this is based on a paper I just published in Aging and Social Policy, and these are the co-author, including Gloria, Zhang and Kayla. Both Gloria and Zhang are also in here too. Let me move on. So this is the paper. Actually, it just came out yesterday. So kind of fun to get the paper published yesterday. So it is in open access. So you can, go to the Aging and Mental Health and take a look at the paper. So a little bit on the COVID-19 statistics for Hong Kong. So we had our first case of infection in January 23rd. So it is already, close to 5 months, into the epidemic. So far, we have 1,085 infection, and we have 4 deaths. And there is no nursing home infection in Hong Kong. So no nursing home infection, no nursing home death. So unfortunately, we have the first frontline health worker infection today. It was very unfortunate. It used to be, if you told me yesterday, I would tell you that we also don't have frontline health worker infected. So today we have the first case. So a little bit about Hong Kong. So we all know Hong Kong is right next to China. So it is an international hub. So give you some statistics. So we have 7.5 million people in Hong Kong. So 2 years ago, 2018, we received 65 million visitors. So the visitor itself is close to 10 times the residents, in Hong Kong. And amongst them, close to 44 million are from mainland China. So you know that the people to and from mainland, Hong Kong and mainland is really huge. So when first we know about the Wuhan virus, we are already kind of in panic, because when you think about a city right next to China and so many people to and from, so we are kind of expecting we will get hit very worst, in mainland China. But in fact, we did manage the epidemic really well. As I said, there is only a little bit more than 1,000 infected cases, and then 0 deaths in nursing home. So we think this is a result of the lesson we learned during the SARS epidemic. So I will explain a little bit more later. So let me give a very brief introduction on long-term care system in Hong Kong. So first one is, it is part of the social welfare system. That means healthcare plays a secondary role, in long-term care. Second one is, all nursing homes in Hong Kong are licensed by the social welfare department, and they need to follow a code of practice set by the government. So there is no nursing home or OH home that is unregistered. So the government has all the information about every single nursing home. So on average, they have about 100 to 120 residents per home. And then, so as of March 31st, so we have 760 nursing homes in Hong Kong, and about less than 1/3 of them are government funded, and then 2/3 of them are non-government funded. Most of them are private for profit. And then we have more than 76,000 older people living in nursing home. So if you look at the data, actually more than 7% of all older people, 60 and over, are living in nursing homes. So we are not talking about a very small number of people. We are talking about a very large percentage. In fact, in most developed countries, we are talking about 3 to 4% of older people living in nursing home. But in Hong Kong, we have about 7% of older people living in nursing home. So going back a little bit to 2003, when we have the SARS epidemic. So at that time, give you a little bit about data. So worldwide, we have 8,000 people infected by the SARS virus, and then 774 people killed by the virus. So that was 2003. Compared with COVID-19, which is much smaller. SARS, the number of people infected as well as people are killed. However, Hong Kong alone, out of the 8,000 people infected, Hong Kong accounted for 1,777. So we accounted for 22% of all total infected worldwide. So remember, we are just a tiny city, in the world. So we account for 22% of all infected people. And we have 299 people dead because of the SARS. So 39% of all total deaths by SARS are in Hong Kong. And then out of the people infected, we have 324 people who are older persons. So 18% of all total infected persons in Hong Kong are older persons. However, 22% of them, of all older people infected, are coming from nursing home. So 72 people are coming from nursing home. And amongst these 72 people, 57 died. So if they are in nursing home, once they get infected, 70% of them pass away. So that is a very kind of disturbing figure. Even worse, they are, if you look at the statistics, nursing home residents are 5 times more likely to be infected than the general public. Second one is 81% of those infected nursing home residents acquired the SARS virus in hospital. So it is extremely important that we need to stop the flow of virus from hospital to nursing home. And then nursing home residents actually have a much higher mortality rate, 78.1%, than the community during older person, 44%, and then the non-older person, 3%. So you see, once the virus get into a nursing home, the mortality rate is really high. And then, so this is the lesson we learned from the SARS. First one is we know all older persons are more vulnerable to SARS, and they have a high infection rate and they have high mortality rate. So this is based on what we learned from SARS. Second one is care home residents are particularly vulnerable, 5 times more likely than the general public. And then, but even worse, once infected, they will more of them will require, more of them acquire the virus from hospital. So 80%, close to 80% acquire the virus through hospital connection. So if we want to stop the virus getting into the nursing home population, we need to stop the flow from hospital to the nursing home. And then, let me go back. So another one is a very high percentage of elderly SARS patients require intensive care services. And then once they are in intensive care, a very high proportion require mechanical ventilation. And then they stay in the hospital much longer if they can recover. So they use up a lot of healthcare resources. So we know that if for COVID-19, if the virus get into a nursing home, a large number of nursing home residents will get infected. They will overwhelm the really fast. So once they overwhelm the hospital, then we no longer have enough isolation ward in the hospital. That means we need to put the older person into non-isolation wards. But once they are in the non-isolation wards, the problem is they will spread within the hospital really fast. Second one is, once it overwhelms the hospital, the frontline healthcare workers are under pressure. So they don't have the luxury or the time to really follow through the very tedious the procedure, hygiene, as well as taking off those, protective gear. So it significantly increases their chance of getting infected. So once you have the healthcare worker infected, they will pass around the virus really fast. So after the SARS epidemic, Hong Kong government did some collective action. The first one is it issued a guideline on prevention of communicable disease for in residential care home. The first one is 2004. So SARS is in 2003, and 2004 the government issued the first guideline, and it requires all nursing homes to have one person designated as infection control officer. So usually this is the nurse. So this person needs to go through the training by the health department in Hong Kong, and they need to follow through the guideline to do the infectious control. And then each year, they pretty much run a fire drill, like a fire drill, mainly because they need to do the infectious control during the flu season to prevent the flu virus to get into the nursing home. So they practice it year after year. So for them, having a good infectious control become really important. Another one after the SARS epidemic is most nursing home has 1 to 3 months supply of PPE in stock. So that is also another very important point that we have. So our response to COVID-19, so this is in the society level. First one is we have intensive surveillance of infection. We don't have any mass screening in the population. We don't have mass screening in the nursing home, but we have very good control of surveillance of infection for incoming traveler as well as people in local community. So once we have anyone who has symptoms, we will send them to the hospital for isolation and for testing. So we use a virus testing. And then once they get confirmed that they will put in the isolation ward, for treatment. And then they will only be released back to the community if they have 2 consecutive virus tests, negative virus tests, then they will be seen as treated or cured. And anyone who are in close contact, the immediate family member, the co-worker, when they say close contact, that means they are together more than 15 minutes without protective gear. Those people will be sent into quarantine center for 14 days for observation. And we also prepare that in case there is any outbreak, we will not use a nursing home as an isolation site for residents. And then we have travel restriction and bans. So we don't allow, so started from late March, we don't allow non-Hong Kong residents to come in. And then starting from April, we require all incoming people, regardless of whether you are Hong Kong resident or not, we need to go through 14-day compulsory quarantine at home. And then we have school closure, we have flexible hours arrangement, and then we have prohibition of gathering of more than 4 people in the public. Right now, it is relaxed to 8 people. So these are the measures we use in nursing home. So the first one is, I talked with some nursing home provider in detail, asked them to document what they did chronologically from mid-January to May. So what they said is once they heard about the Wuhan virus, they become very nervous. So right away, they impose stringent visitation rule. So they do not allow outside people to visit, the nursing home. Second one is they also impose very strict hygiene patterns. So anyone, when they first get into the nursing home, all the staff, they need to have temperature check. If they have fever, 38 degrees Celsius or above, they will send back home, so they will not be allowed to work. And then all workers, they need to wear face masks all the time. And then all the outside visits by family member or volunteer are started from early February. And then the nursing home use Facebook, FaceTime, Zoom to connect the residents to outside, but there is no visitation. And then all staff workers, they need to check for temperature, and then they need to wear face masks in all, while they are working. And then their mentality also change over time. For example, when at the beginning in the January and early February, a lot of the workers, they are doing it, to protect the residents. But then they heard about how serious the epidemic is or was at that time in China. They do it more also for themselves, because they know that if they caught the virus at work, Hong Kong is so congested, they will bring the virus back to home, and then they will infect the whole family. So everyone becomes so nervous about what's going on. So I told even the chef in the nursing home, at the past, they may be a little bit relaxed because they don't have face-to-face contact with residents. So their hygiene patterns, they don't wear the hats, to kind of cover their hair. But after they heard about the virus, everything become really kind of careful in terms of following the hygiene patterns. All residents, they're asked to eat and to stay in their room most of the time. So the nursing home stopped all group activities right away, started from early February. And then, as I say, strict hygiene patterns is observed. Anyone, when they get into nursing home, you need to clean your hand using soap for 20 seconds, or you need to use, alcohol-based, fluid, hand cleaner. And then there is also social isolation in care home residents. For example, in the cafeteria, they are encouraged or required to eat in their room. So for people who eat in cafeteria, they will make sure they are about 1.5 meters apart, and they usually set area between people. And then they allow people only sit in one direction. So if they have a table, so all residents are sitting facing the same direction, and they have barriers in between two people. And then the government also stopped all non-urgent hospital visit. So in order to stop the flow of virus from hospital to nursing home, started from early February, the government, the hospital authorities stopped all non-urgent hospital visit. So in order they allow people with chronic disease to refill their medication without seeing a physician, and then they encourage the family member or other people go to the hospital or the pharmacist to get the medication. And then we also, after the SARS epidemic, all nursing homes have a visiting medical doctor program. So they have a visiting medical doctor come to the nursing home each week to take care of the patient. So they stopped at the beginning. The government also said, nursing home continue the services, but they want to reduce the potential flow of virus from hospital to nursing home. So they said they will reduce the medical doctor visitation program. However, what they found out is once the hospital asked that the residents don't go to the nursing hospital for non-urgent care. So the government, in fact, bump up the services for visiting doctor. So the visiting doctor will take care of most of the healthcare needs right in the nursing home without asking the nursing home residents go to the nursing home. So with all this measure, everything went quite well in Hong Kong. So that only started to kind of, because we have very low. We know in Hong Kong we have a peak, in the infection in March, mainly because of a large number of overseas Hong Kong residents who are studying or working overseas. They come back to Hong Kong because they know, that in fact that the control in Hong Kong are quite well, particularly people from UK and from North America. So they bring the virus back. So we usually have a single-digit infection at that time or very low double-digit. But during that 2 weeks, we have 50, 60, cases or 30 cases per day. So it was a very tense moment. And then, the number started to drop down in April. So by early May, the situation stabilized. So the nursing home started to allow visitation on the Mother's Day. So they allow family members to come to visit the residents, but they do not allow the visitor to come to the room of the resident. So instead, they have a designated area in the nursing home as a visitation area. So they make sure the family member and the resident will stay in the visitation area. And before the family member get in, they will have a body temperature check. They will need to just sanitize their hand. And then they do not allow family member to bring outside food to the nursing home. And then they start to have small group activities also in May, but they observe the social distance. So you want to make sure people are at least 1.5 meters apart. So let me stop here. This pretty much summarizes, what we did in Hong Kong. And if you are interested, a little more detail, you can read the article we just published.
Thank you very much, Terry. And I think we shared a link to the article already on the website yesterday when we were advertising the event, but we can share it again when we share the video, as also the country reports that some of you have completed. So now we're going to move to another country. We're going to move to South Korea, and I'm delighted that we have Hong-Soo Kim here. And yeah, thanks for joining us.
Hi, everybody. As introduced, I'm Hong-Soo Kim, Professor of Public Health at Seoul National University in South Korea. South Korea is located in East Asia. Our population is about 50 million. I would like to thank Adelina and her team for organizing this webinar session. I will give a short presentation on the COVID-19 situation. I'm sorry. And long-term care response in South Korea. Okay, I will begin with a brief summary of how South Korea has contained COVID-19 quite successfully so far, and present COVID-19 measures related to long-term care, and end the presentation with a summary of the current progress and future key agenda for Korean long-term care response to COVID. Sorry. The first Korean quarantine model. So the first case of COVID-19 in Korea was reported on January 19, and the number of new cases confirmed peaked at 909 on February 29, but the curve was flattened down to 64 in 3 weeks. The peak was a result of a mass infection spread by a single religious group in Daegu, a city in the southeast region. Because of the rapid flattening of the curve with limited lockdown, Korea's containment measure got attention from abroad. The number dropped to 2 on May 6, and after the Korean government loosed loosened the social distancing rules, there were a few spikes in May, including an outbreak at a nightclub and a cluster infection in a logistics center in Seoul metropolitan area. At the end of May, the new infection cases per day became below 40. The Korean government and experts said a few more small spikes are expected and they may be unavoidable. But we have established a quarantine system that is working. So we think we are likely to be able to contain them again while keeping limited lockdown principles. Sorry. By the end of May, more about 11,000 cases have been confirmed, and 90% of them have been released from isolation. The number of people died with COVID-19 is 269. So the fatality rate so far since last January is about 2.9%. Korea's key quarantine strategy, so-called K-quarantine, can be summarized: test, trace, and treat. First, testing. We prioritized early detection through massive diagnostic tests. More than 9,000 tests have been performed by the end of May, which is more than 1.7% of total Korean population. And the test results is available within a day. Second, tracing strategy. We have traced and monitored contacts extensively. We have used not only epidemiologic survey, but also various objective data, such as credit card transaction and mobile GPS data from patients' car and cell phones. The new case information is delivered as an alert to all the residents in the region via personal cell phone as soon as the information is available. And the public can check the identified travel route of a confirmed case on the Open Government website. Lastly, treatment strategy. The moderate and severe cases are hospitalized immediately, and the mild cases are quarantined at home or at a living treatment center for 2 weeks. Through this strategy, early detection was possible, which has reduced the infection of health and social care staff and mitigate the demand for uncontrollable increase of medical facilities. Other key factors contributing to flattening the curve on COVID-19 are transparent communication between the government and the public, high level of voluntary cooperation and compliance with the public in practicing social distancing rules. KCDC was better prepared through past experience with MERS in 2015. Many experts say universal health insurance also helped Korea's response to COVID-19, as there is no or very low cost for test or treatment paid by individual patients. Now, based on these successful population level measures for containing COVID-19, there are also measures specific for long-term care in Korea. This is the most recent statistics for confirmed case and deaths and fatality rates. The highest prevalence was among 20s due to ties with an outbreak in Daegu. But fatality rate is concentrated among older adults. This is similar to the case of other countries. Thus, older people make up about 10% of infected cases, but they make up almost 80% of fatal cases. On the other hand, due to the success of population-level measures, the absolute number of infected cases were about 1,100 and the fatal cases were about 250 among older people. These numbers are quite small considering that the total population aged 70 or older in Korea is over 5 million. The success of measures for general population also contributed the relatively minimum impact of COVID-19 on nursing home residents. Only below 400 residents in 25 nursing homes out of 180,000 residents in 5,300 facilities were infected since last January. And no death was occurred in nursing homes as all infected cases were transferred to hospitals. The CDSCH has developed preventive measures against infection in high-risk institutions, including nursing homes. The major measures include monitoring residents' health, building an emergency response system, instituting staff-level measures, providing the public mask. Entry of visitors to nursing home were restricted and stringent entry and exit management of workers and residents were implemented. There are additional measures to contain COVID-19 infection in nursing homes. Temporary cohort isolation and preventive tests for all residents were conducted in some nursing homes in the special disaster zone. The public long-term care insurance implemented temporary reimbursement plans for long-term care agencies to minimize the negative economic impact. Long-term care service providers may order public masks online for their care workers at a relatively low cost. In the community, all social welfare facilities were closed in late February. Some flexible service delivery has been available, but which might not have been enough. Some temporary assistance programs and supplementary budget for socially disadvantaged groups were allocated. In summary, the attack of COVID-19 to long-term care institutions has been managed quite well so far in Korea. This is partly attributed to the set of successful population-level measures with limited lockdown. While keeping the infection in the community to a minimum, some more aggressive approaches were adopted for the vulnerable long-term care users in the institution and those who use the social welfare facilities. And financial aid and other resources were also provided. The public long-term care insurance with the universal coverage of older people with certain dependency also helped to implement the measures to contain COVID-19 in the long-term care field. It is highly uncertain how long it will take for the current COVID-19 pandemic to be over, and whether the second COVID or more different pandemic will come. But a clear lesson from the current pandemic is that the risk is unequally distributed, and it is higher among care recipients and providers. And so we urgently need to strengthen social protection of health and care. More specifically, we need to provide better preventive measures and support for people who need community care, their family, socially isolated nursing home residents, and care workers with challenges in job security and work quality. Active policy discussion are underway on how to integrate health and social care delivery and how to advance care technology without compromising long-term care quality under the current threats from COVID-19 and potentially more. And this is a short video clip for later. So I think this is what I prepared for today's presentation. Thank you for listening.
Thank you very much, Hong-Soo. That was a fantastic set of 3 presentations. Some of us in the UK are really thinking that there's a lot that we could be learning given the kind of numbers that you have at the moment and the ones we still have here. And I think other countries might be feeling the same. So now we have the more relaxed part of our webinar, which is basically where we can have a discussion. I'm going to be monitoring the chat box if you want to ask your questions there, but if somebody wants to just start talking, as long as it's not while somebody else is talking, that's also fine. I noted a couple of questions earlier. There was one from Sarah House. I think you had the question for both Maupin and for Terry. Sarah, would you like to ask your question? And you may have more questions for Hong-Soo as well, I think. You want to unmute, Sarah? Oh, okay. I'm going to ask the questions for you, no problem at all. So let me start from the top. So for Maupin, the question was, so how did and I actually be very interesting to hear about the same question for South Korea, which is, how did what happened with the staff that moved into the care homes, and were they supported in terms of, for example, the fact that they couldn't be with their families and the implications that this had? So maybe we could hear that first from Malaysia, and then we can hear also, because I think in South Korea you had a similar experience, so we could hear both. So Maupin first.
Yes, so the special situation in Malaysia is that most of our care home workers are quite young, or so that they're kind of a diverse group. So there are the older ones who had retired and have have grown kids, and then there's the younger ones who just graduated from nursing schools. But a lot of them got called back to the ministry, but there are also the foreign workers. So so that actually is a large bulk of our care workers. So they already live in relatively modest accommodation outside the care homes. So for them to move into the care homes, theoretically, actually potentially allows them to move into better accommodation compared to how they already live, and it's free. So so it's actually an incentive for them to go in, for some of them. For others, it's a sacrifice, and there aren't a number of care home workers who have family to go to that can't move in, and some of them have to make that choice whether to stop working, because of course, as we had that outbreak, and as we were doing the mass screening, the care home owners got more and more scared, and so a lot of these workers were actually stopped going to work. But we will run into staffing problems if this kind of trend continues. But for now, it seems okay. And the other thing that was worrying us was because initially when we started saying no visitors, we actually had family members being very aggressive, trying to break into the care homes because they can't see their own loved ones. So, but they've actually got used to just using video conferencing. So WhatsApp video calls is what they communicate mainly with the residents, and that's how the residents, and that's how the workers actually communicate with their own families as well, whether in Malaysia or abroad. But it is getting to be a strain. The ones with the local ones who's got families are actually missing their families now.
Thank you very much. And Hong-Soo, do you want to tell us a bit about the South Korean version?
Yeah, I think in South Korea, the staff don't need to live in care home. There's no lockdown there. So any 25 nursing homes have some infected cases. So there's not much that problem happened. So once a care worker was infected, she was quarantined. So there was a subsidy to hire another care workers. for their homes. So that problem not much happened in South Korea.
Thank you. And may I bring in also Cheng Shi, who she also authored was one of the authors of the China report. And I understand, Cheng, that it's quite common in China for the staff to live in the care home already in normal times. Is that correct? So it was, or not, or was that a special measure for the response to COVID?
Oh, well, thanks for the question. I'm thinking that in most of cases, the staff are living in care homes in mainland China. So they are just living with the older people. And when the COVID-19 outbreak, it was during our Spring Festival. So lots of staffs, they came back to their hometown. So during that time, I don't think the number of the staff is as much as Europe. But later on, I think some staff will go back to the care homes, but they need at least 14 self-quarantine. Yeah.
Thank you. And I believe you also had a question you wanted to ask to Hong Soo about South Korea. You want to go ahead?
Yeah, I'm interested in the supplementary financial support for the disadvantaged groups. So I'm quite interested in the details on that. For example, what's the eligibilities? Are there any regulations on that, or is it cash only? Thank you.
Yeah, there is interesting question, but that a supplementary fund plan has been just started, so they are working on. So I cannot share detail right now, but I may send you detail when they open their plan. Yeah.
Thank you. We had a question from Maria Aurora. It was about the length of quarantines, I think. And I can't remember which country you were asking about.
Yeah, I was asking both Malaysia and Hong Kong. I mean, Terry has answered my question. It's just Malaysia. Are your borders still closed?
Our borders are definitely closed. So if you're not a Malaysian, or if you don't have an affiliation to Malaysia, that you're not allowed in. But all our returned travelers and those who come back from schools, and also some of them work abroad, actually are mandatory, have a mandatory quarantine period of 14 days. They're tested on arrival, they're quarantined in designated hotels, and they are then only released after a negative test 14 days later. So it's very, very strict.
Do you have any intention of when the borders will be open? I mean, locally here in Malta, we're being advised that they'll be open again as of the 1st July, and only to certain spots within Europe, I believe. We're still awaiting the local government to tell us which countries that, I mean, the borders will be open. Do you have any ideas? Both, I mean, Hong Kong, Malaysia, South Korea. Do you have any ideas of such things?
No idea. At the moment, we feel that we want to keep everybody out because we're quite safe.
That's what we want. That's what we want. But the government has different ideas. I mean, it's all about economy at the moment, not health.
Yeah. I think South Korea has never closed the border, so we still open. Yeah.
Oh, that's something to think about. Okay.
Yeah.
Okay.
We opened the border until end of March. So in fact, there was protest in Hong Kong trying to force the government to shut down the border. So the government at the beginning say no, and then eventually, as the epidemic get more and more people come in with infection, then the government shut down the border. And we have a talk right now to open up part of the border. Mainly, I think, to the country that has good control, like Korea, Taiwan, or mainland China and Macau. For quarantine, actually, we have a 14-day compulsory requirement. So anyone who come in, first we need to, there is two phases. At the past, it started from until March, you come in, you get a kind of test kit, and then you go to do the sample yourself after you settle down in your house. And then you ask a family member to bring the sample to a collection station, and the government will test the sample. And if it is positive, they will let you know, and they will find someone to bring you to the hospital. And if you are not positive, you will not receive any message from the government. So that was until early April. So my son came back from Canada, in early April. So he went through that process, and he need to stay in our apartment for 14 days. So the government gave him an electronic, base net that has a GPS device to monitor where he has. So we have people who did not follow the instruction and get sent to prison. So we have, I think, 2 or 3 cases that are people who violate that one and then sent to prison. And then started from late April, the government changed the policy once again. So anyone who come into Hong Kong, they need to collect the sample right away in the airport. And then they need to wait in the airport. The government will rush the sample back to the test center. So about half a day later, they will hear about the news, the result. And then if the results are negative, they go back home and then follow the 14-day quarantine. And if the results are positive, they go directly to a hospital. Right now, the government also, depending on which country you come from, if you come from specific country, you need to go to quarantine center instead of going back to home. So for example, if you come back from Pakistan or from India now, the government will send you to quarantine center for 14 days. So the quarantine center is usually vacated public housing unit. So the whole block are used for quarantine. So they use it for and then if you are coming from specific country, I think Nepal is another one that they come in, they will go to the quarantine center.
Thank you very much. That's serious measures, and they look so different to what's happening in other parts of the world. We have a question from Simon Bottery. Simon, would you like to unmute and ask it? If not, I'm happy to read it.
Yes, thank you.
Yeah? Hi.
So, hello. I was interested. First of all, thank you for all 3 speakers. Really, really interesting presentations. I was particularly interested in whether in Hong Kong, South Korea and Malaysia probably in Malaysia where the care homes are actually registered, do you have formal state inspections of those homes, as for example would happen in England, and have those inspections continued? Because there's been quite a debate here with some people feeling that we should be putting this ring around care homes and no one should go in, and yet other people are actually calling for those inspections to be reinstated because of concerns about care quality within the homes when they're not being inspected.
Well, for Malaysia, most of our care homes are actually unregistered. And we are actually pleading for the government to stay out of this for now, because their presence might freak people out. So they've been quite good. They've kind of listened a lot lately, because prior to this we had huge struggles with getting regulation in the care homes, and the government were being too strict, and the care homes therefore safety by numbers, let's all not get registered, and the government can't do anything because we all shut. What are they going to do with all the residents? So so it's similar situation. The government are being very, very generous, because if they spooked out the care homes and then the care home owners suddenly all shut up shops, then we'll end up with all the care home residents in our hospitals without COVID-19. So so that will be not a very good thing to happen to our country. So they're being very, very obedient, our government, touch wood, and they're actually staying out of this. Yeah, they're only going in to test and they're out again. And when they test, they don't really ask if you are registered or not.
Thank you.
Thank you. So Terry, you want to answer about Hong Kong?
I did not ask this question, so I don't have an answer for you. But all nursing homes are registered in Hong Kong, so they have at least annual inspection in the past. And then the government also did certain inspection. But I did not ask your question, so I don't know whether those are continue or discontinued in the last 4 months in Hong Kong. So sorry.
Thanks, Terry. And Hong Su?
Yeah, I think South Korea, the 5,000 nursing homes are reimbursed by public long-term care insurance. So they have to get the inspection regularly. And I think over last from January now, I think the inspection is temporarily hold. And but the more active discussion now is the assessment for eligibility tests. Usually that has to be done by face-to-face, the visit elderly and their family members home, but this also has been suspended. So people are worried. Some people really had to get the assessment and to be eligible, but now it's suspended. So now we are discussing about a different way of doing assessment without limited contact. So that's the discussion undergoing.
Thank you very much. I know we have people in here from other countries, and there's actually a very interesting question. So I was wondering whether maybe we could hear from Malta, China. I don't know if we've got somebody from Canada as well, but I know this is also an issue. So if you're able to answer for your question, please unmute and let us know. So maybe, yeah. Hi, Aurora.
Hi. So the main topic is whether the authorities are still going in and inspecting the homes, right?
That's right.
So for a short period of time, we've got
in Malta, yeah?
Yeah, in Malta.
Sorry. Yeah.
So we've got the Social Care Standards Authority in Malta, and it's only been incepted since a year or so. And they've been doing some very rigorous work. But during the initial stages of the pandemic, all visits by the auditors were stopped. So, but complaints were still coming in from relatives, and they tried as best as possible to see to the complaints virtually. Okay, it wasn't such a good thing, but better this bit than nothing. Now, since a couple of weeks, they've started going back in. They've got their PPEs and everything, and they're doing the inspections as they were doing prior to the pandemic. So basically everything is back to norm. They've got the PPEs, and the audits are in full blast now once more. So that's puts service users, minds, relatives, substitute decision makers, their minds at I mean, basically they're happy now, knowing very well that the older persons are being taken care of by the inspectorate, kind of thing, that the services are being done as they're supposed to be done. But they've got everything. They've got the PPEs, and they're not allowed in unless they've got the full PPE thing.
Thank you very much. Any other countries would like to answer this? I know we have a few people here who've authored other reports. Cheng, I'm always worried in case other people are doing other things, but Cheng, would you be able to answer for China? Don't worry if not.
Hi.
So we were discussing inspections and whether inspections of care homes had been stopped in China during the pandemic, and if so, what were the issues and have they been started again?
Oh, well, to be honest, I didn't see too much data on what's happening in care homes in mainland China. The only news I heard, it happened in Wuhan, which is the original cities, the first city perhaps we know where outbreak the COVID-19. So I know there is care homes and lots of older people still got infected, and yeah, some of them passed away. But later on, I didn't know any news about that. Yeah, and the data for COVID-19 in mainland China we can't tell the age groups. So very less information for that.
That's all right, thank you. And Simon, would you like to comment on the UK situation and the debate here? Is that you are muted?
Yeah. Okay. Well, I can only speak for England, but in England, the homes are inspected by the Care Quality Commission, perhaps once every 2 years, once every 3 years. When the epidemic obviously was severely affecting care homes, the Care Quality Commission suspended its inspections. And I think generally at the time that was applauded on the basis that care homes said that they had enough to be getting on with trying to sort of keep the residents and staff safe. But there has been recently a few voices saying actually from residents and residents groups saying that they'd like to see the Care Quality Commission re-inspecting and going back in. And I think the concern, which I think is an understandable concern, is that when homes are so closed down, you haven't got residents going in, you haven't got inspectors going in, there is a concern that the sort of quality of care can dip. And that has been an issue for families here for quite a time. So it's not a resolved debate by any stretch of the imagination.
Thank you very much. Have we got any other questions or comments are also welcome, or experiences from other countries, or any last words from any of our speakers? Hong Su, yes? Oh yes, sorry, there was a question about face masks that I forgot to share. And
we voluntarily have been wearing the masks.
Everybody wears face masks in Malaysia. Yeah.
But I tell you an interesting story. So first one is at the beginning, when people are wearing face masks, the chief executive of Hong Kong, that means like a president or a governor, say on public said, face masks are not needed. He said to the civil servant, if you wear the face mask, I require you to put it down, to take it down. So that was from the governor of Hong Kong. But then no one listened to her. Mainly because, I think the memory of the SARS in 2003 are still very painful. And then we have several very respected physicians who told the public, don't listen to those politicians, and then wear face masks everywhere, in public. So in Hong Kong, the situation was, started from late January, we already have more than 70% of people wearing face masks. And then by mid-February, we have more than 98% of people wearing face masks. Although, as I say, the governor said you don't wear face masks. You should not wear face masks. Even nowadays, I think I would say, definitely more than 95%, 96% of people are wearing face masks in public area. But
Thank you. Thank you very much. Any other comments?
Can I chip in?
Yes.
From Hong Kong. Can I chip in about the care home in mainland China? Because actually my grandparents live in care home in mainland China. And I can only say for my own experiences, because during the Lunar New Year spring break, I went home in mainland China and I tried to visit them. But then no relative was allowed to go in by then. That was January 25th. We also got the message from the care homes to all relatives' cell phone saying that we ban all visitors visiting from that time on. And my mom said recently they opened up. That was the mid of April. Only till then, my parents were allowed to visit my grandparents. And then again, similar to Hong Kong, they don't allow visitors to go to their homes, to go to their rooms. So they have a designated area for everybody to visit, and they have to sit 1.5 meters away. So my mom said it was like visiting somebody in prison. That was a joke, I know, but that was what's going on in mainland China. And all my grandparents, both of them got COVID-19 tests and they went back negative. So that's my personal story relating care home in mainland China.
Thank you very much, Bridget. That's very, very welcome comment. So yeah, let me check the mailbox. So yeah, Simon says he's impressed that Hong Kong still remembers so much the learning from an event that was now seems quite a long time ago. But of course, yeah, the similarities are striking. So unless there are any other comments, questions, I think we probably have finished for today. I'd like to thank again the speakers, Mao, Terry, and Hong Su. Thank you so much. I know it's late in the day for you, so this is even more appreciated. We will be sharing the video. If anybody has any second thoughts about anything they said and they want us to edit, please send me an email, let me know. And please keep sending your reports, keep sharing information, keep letting us know if you publish any other work or any other things that you think would be important. And we will be, I think the program for next week and the registration is already on the blog, but we'll be sharing it again. So thanks again, and have a good rest of the week. Thank you. Bye.
Thank you.